Right. Good evening, everybody. Today I want to continue the talk from the last discussion we had on COVID-19 vaccination and go into general idea of the vaccination as it presents itself today. There were some changes, again, like I mentioned, in the news with Trump administration and NIH reducing this dosage of vaccines to a core few diseases from 72 to 11 and spreading out the shots and splitting up like MMR vaccine and DTaP and other vaccines, splitting them up so the child gets only a single dose for each disease, and that is seemingly a progress in the right direction because the vaccine schedule has not been changed for many decades, and children unfortunately been encountering some adverse reactions to the vaccines as the VAERS system that we have in place in order for doctors to record adverse reactions. It's been absolutely swamped with all kinds of reports, and obviously there's no liability to a doctor or healthcare system. But nevertheless, they have to do due diligence and record these occurrences in different places. And what is emerging is the catastrophe of side effects. And even if you're going to question there's a recording system and say that it's not a proof of anything, nevertheless, I would like to discuss how the Torah views such information, because as you can imagine, when Torah was written and compiled into halacha and the law that we have today, and the development of all historical development of all occurrences in the Jewish community that went into thinking by leading Torah giants of different generations, produced a certain scope of assessment of risk and a picture of what's considered danger. Unfortunately, the Jewish community experienced many types of danger, whether through pogroms or different types of expulsions. There were diseases in Europe that were unfortunately blamed on the Jews poisoning the wells and so on. Yes, like anybody else, based on the Shylock's famous monologue, if poisoners do not die, the Jews would succumb to the same diseases as non-Jews, and therefore it's important to understand how this assessment took place based on the Torah and the some rules and principles that we have. Like I mentioned in the previous lecture, we have Chazaka and Rov and Safek, and Safek Nefashot is always when Machmir, we are stringent with Safek Nefashot, to the point that we do not have any restrictions on Shabbat or Yom Tov to violate those holidays in order to save life. And that is clear to most people in most cases. What is not clear in the cases like vaccinations, what's not clear in cases of doubt, what was the causation and what was correlation between time when the person, let's say, received the vaccine, whether it's COVID-19 or child receiving regular immunization, and the adverse effects that resulted from it. But the Torah nevertheless understands that there could be a time span between when injury happened and when actual symptom emerged. The famous part of injuries where the Torah discusses if somebody strikes his friend and he falls sick, and then for 3 days, let's say, and then he gets up and he walks on a crutch, then it's considered that the system is dealing with it, but later on he falls back sick and dies. Question is, can we attribute it to the original injury since 3 days passed, or is it something else? Now, today we have better tools for assessing this, so we can trace it for even longer. It could be several months down the line, or even years, when something shows its effect. And vaccination is one of those things. When some pathogen is present in the body, let's say tuberculosis, for which, by the way, America does not vaccinate, and is probably the most dangerous of all pathogens that exist today, and yet there's no vaccine for that. So it's a big question thrown at the medical system. We vaccinate for diseases that have been eradicated, but we don't vaccinate for diseases that are still prevalent. In the South of America, in Texas, where there's large populations of Mexicans migrating to the United States, there are wards in the hospitals that are set up just for TB patients because it's so prevalent amongst the Hispanic population. And yet there's no vaccine for it. And there are no vaccines were ever developed for diseases like cholera and other diseases. And they went away by themselves. So that's another question. Is the vaccination really required for things that are not communicable, or things have been eradicated? And polio has been eradicated. There's no tetanus anywhere in the world except for like one part in Africa. And in general, this assessment has to be reviewed and reassessed. What is threatening today populations? During Obama administrations, there were some scare of different diseases emerging, and none of them manifested themselves. They scared us with Zika virus. They scared us with the other antiviruses. Recently was one on the ships, and that doesn't catch on. So the pharmaceuticals and some governments, they don't have a chance to develop all kinds of emergency situations like they did during COVID, and start creating vaccines or patenting some new devices to supposedly help the population. A lot of that goes sideways. B'chazdei Hashem, that God is merciful and does not allow some bad actors who are trying to simply capitalize on suffering of others. That exists. You probably know many egregious violations, and recently was the Fauci testimony, and some officials now coming out and pleading guilty to misinformation during the COVID period. And that all amounts to the corruption that exists in the systems, and those have to be uncovered, and the guilty party has to be punished because the cost is too heavy to bear on the population. So back to our fundamentals. So I can't discuss all the details of vaccination. It will take hours upon hours. I myself have a lot of experience with that, but I'm speaking generally to people who are on the crossroads, on the fence. They don't know what to do with their children. They don't know what is the proper course of action. From one side, every parent, every normal parent, conscious parent who doesn't simply follow edicts and regulations will want to protect their children and their lives and from injury or, God forbid, death. And because the prevalence of injury in our generation has risen to levels were unseen before, all kinds of adverse events from COVID shots and from the vaccinations have created a weak population of autistic children and other things. Again, you can argue whether autism is related to vaccines or not, and this is going to be an ongoing argument, but we definitely know that this did not happen in previous generations. They tried saying that it was not diagnosed before, but yet we don't see 40 or 50-year-old men walking around with helmets on their heads, banging them on the walls, like today's children who, after vaccination, somehow develop these symptoms and neurological damage. Having said that, I'll be in the devil's advocate, and I'll say that we may argue endlessly whether there's a proof, whether there's any studies proving anything, but the Torah doesn't take that angle. Torah takes a different angle. Torah assesses both statistical and actual danger. Torah tells us we do not go to a place of danger, and Torah assesses also damages for the payments for damages that one might cause another, if those are evident that came from that source or from that person or from that particular event. And Torah will describe 5 different damages: shevet, ripui, boshet, tsar, and nezek, which are corresponding to type of damage the person incurred. And then it measures different levels of injury, and those injuries come from from a hit or fall, or item used to injure someone else. So somebody injures with a stick, it's one type of injury. With a metal knife, let's say, is a different type of injury. Fall is a third type of injury. But in all of them, there has to be enough to injure a person. So both the Gemara and Mishnah and later Rambam goes into defining what is considered kedei lehamito, meaning enough injury, enough to kill a person from the particular item. And the Torah says in pasuk in Bamidbar, ve'im bikli barzel hikau ve'amot. If somebody hits the person bikli barzel, with a metal object, as opposed to a wooden object or some other object, rotzeahu is considered rotzeach as a murderer. Yumat harotzeach, and he should be put to death. On this, the Rambam says, Kli barzel lo natnan lo Torah shiur. The Torah did not give a shiur for Kli barzel, just like the Gemara states, shenemar im b'kli barzel hikau v'yamot rotzeahu. If he hits him with a metal object and he dies, he's a rotzeach, is considered a murderer. Ve'afilu b'machat, and even with a needle. Ve'hu sheyeh lo chad, kmo machat or sheput, as long as it's sharp, like a spear or like a needle that we know, or sakin, or knife of some sort, but if he hits him with different types of barzel that does not have that sharp edge, then we have to view it differently as a dull object that might be used. So what's called umdena. Umdena is where we assess whether something has that potential to kill. And that is the cornerstone of all damages and all liability for murder that exists in Torah. Therefore, this is very interesting that machat is mentioned here, because we know that needle can do damage. We know that, probably they also guessed that once the introduction of iron happens, then society can move on to the smaller and finer instruments that can do seemingly small but yet very effective damage to the body. And today we see that the primary damage today, penetration of the skin, happens through a needle. And that what's injected or what leaves infection that results in some other toxicity or staph infection of sorts, that needs to be assessed carefully. And today we can assess that much more clearly. Even post-mortem assessment can be done in order to determine whether the person was poisoned or he died from other causes. And that's done regularly in CSIs around the world, where we have refined that skill of a coroner to assess the crime that was committed against a person. From this, it is evident that we have to have a clear idea of what things are. That's why the informed consent is very important in all these administration of public health. We have a history of vaccinations, starting from the generous smallpox vaccine and onward to the development that is happening today. It was mRNA, spike proteins, and other things that we know very little about. What we are told is now it seems that not as clear as what was presented before, but yet many companies are in the race to develop new products based on mRNA, and the consumer of such things has to be aware. Unfortunately, a lot of people will trust the system, trust the government, and trust so-called experts that will tell them things and will bear no responsibility afterwards. So one has to keep in mind that there's no liability for these products. With other products like pharmaceuticals of other sort, there are some liabilities, and doctors usually will stop the patient from taking drugs or certain experimental procedures if they prove to be harmful to that particular person, regardless whether most people benefit from it or not. But here it's a public health, which is a different structure, and Torah understands public health, but also warns against, not having proper consent by a person who does it. There's autonomy to a person's body that we discussed many times. The person cannot be violated and be forced into a procedure, no matter how benign that procedure might be. The person can't ask you to stand somewhere and force you to do so without violating your autonomy. And more so if somebody is giving you a substance or injecting you with something, there has to be a clear disclosure of what is being done. The truth is that many of these vaccination practices have come too late to help anybody, because there's a lot of evidence that many of these diseases of the New World, post-industrial revolution, they happened primarily because people gathered in cities and they had unclean, unsanitary conditions, which led to a lot of these pandemics that took lives. But once we figured out the plumbing, we figured out cleaner, a better environment for people to live in, those were already on the decline when vaccines were introduced. And you can see a lot of charts and a lot of evidence where all these diseases were in decline, and vaccine was introduced at the very end, and it really helped nothing. It did not help to eradicate the disease, but rather we saw the decline of all these diseases. On the flip side, what happened is a lot of people were injured through the vaccine itself. There's some numbers that suggest that I think in the 80s, when they were giving developed the measles vaccine, only 2 people died at a certain period, and in the same period 127 people died from vaccine. That's what I saw. I'm not sure of the clear numbers, because again, whoever compiles these numbers has to be questioned whether they have correct numbers, but the mere fact that some of these vaccines were done away with, like the swine flu vaccine that injured tens of people, was stopped. This was before the Reagan administration, 1986, before they had no liability for the injury, so the pharmaceutical companies would refuse to manufacture something that could possibly put them in courts for years. And after they got liability after 1986, then all hell broke loose, and we see those 72 doses that emerged, and now, thank God, they've been reduced to some normal number. I don't consider that a safe number either. I don't consider any vaccines safe. By the way, when they say vaccines are safe and effective, in legal terms, it does not mean safe and effective at all. Meaning you cannot sue anybody because they told you it's safe and it was not safe. It means that it carries risks. Like all pharmaceutical products carry risk, this also carries risk. So colloquially, calling something safe and effective, it's a bit of a gneva dat. They're stealing someone's mind by equating it with normal understanding of safe and effective that we have with every other product of food and so on. So sanitation helped tremendously. The famous story is the Chicago story, public health case with cholera infecting the residents of Chicago, no matter what social category they belong to. Rich and poor were all affected because Chicago was on the water level, on the sea level, and a lot of sewage would back into the plumbing that existed in the buildings then, and famously they raised the entire city, literally, or whatever was the city then. They raised it to one floor, or what today comprises the Chicago Underground, and they were able to push all the sewage downstream. And after that, cholera disappeared in Chicago. The water was cleaner, and they did not have reinfecting of the water sources. That's actually the documented, recorded case. When it comes to history of vaccines, you can look at Susan Humphrey's book. It's available on Amazon. It's called Dissolving Illusions, so I don't have to go in all the details. You can see the history of vaccination and how the diseases were declining already prior to vaccination tremendously in the entire developed world. And when they were introduced, they were already produced very little effect. Elsewhere in the world where vaccination was not available at all, people didn't just die from those diseases. Yes, there are even diseases today in the dirtier countries like in India, Pakistan, where the water source is constantly polluted. In Africa, the children walking around with blown up stomachs and was the diarrhea at all times because the water sources are polluted. But it does not mean that if there were cleaner environments, that would require any vaccination. Unfortunately, Bill Gates Foundation has caused a lot of trouble in those countries by testing out the vaccines in India and other places, and I believe that there's a lot of evidence that it caused death, and unfortunately, the people succumb to these practices of NGOs and other institutions. So I highly recommend reading about the vaccines and how they emerged. Another thing is the technology of vaccines. Technologies are different. They use adjuvants. They use preservatives like mercury, thimerosal, and other preservatives in order to give a shelf life. By comparison, when we had vaccines in Soviet Union, we only got like 3 vaccines. By the way, TB was one of them. And that's why most Soviet citizens came to America. They would react to TB testing. And it's not because they have TB, it's because they've been given a TB culture back in the day. And we were vaccinated in schools. They would bring a couple of nurses, and vaccines were freshly made, and most of them were not attenuated, but live vaccines, which were given in a small portion, not to cause the disease, but it was freshly made. It didn't require shelf life because in the Soviet Union, nobody asked you for informed consent or anything like that. The people were vaccinated, and everybody believed it was for their good. But we had no injuries from those shots. You couldn't find an autistic child for miles. We had schools that had thousands of students with no wheelchair access. Literally, so we did not have, and yes, you might think, oh yeah, we didn't know about those. No, there were injuries, and there were, like in every other country, but in country of 300 million, there was no polio cases like in America. There were no iron lungs, where the children lived. And all of that happened in the United States and not elsewhere, but it will be presented as if the nature itself attacks people with polio. Yes, and maybe in dirty places, but in developed countries, it never happened at the scale that it was in the United States. And it was obviously a Cold War, so I guess Soviets they were not in agreement with health administration in the United States, and therefore we didn't even have those things they claim come naturally in the world. So it's very important to know the history and how all these things developed, and also the structure and the methods of administration. So when a doctor administers several shots in the same day to a child, or there's a triple vaccine in a shot, that is potentially has a greater harm, then the Torah would assess this as a damage. If right after the vaccination child develops fever and other symptoms, even though those that are already mentioned in the vaccine insert, if you open it up, it tells you what adverse reactions a person can have to those. And even under generally being safe under the public health regulations, a person does not have any obligation to take something that could be harmful for that person. Another important principle we have in this regard is the meto echav machmat milah. This is a principle that's applied in many places in Shas, in the Gemara, in Halacha. If the brothers die because of the Brit Milah, the case is that two brothers die because of the circumcision, because they're hemophiliacs and they couldn't stop bleeding, and the third brother is then exempt from the Brit Milah. So it remains arel, it remains uncircumcised, and many aspects of halacha address that, whether it's for the kohanim, is whether for performance of other mitzvot that require a person to be circumcised, or simply for assessing the danger in something that is similar to what we do. So assessment of danger is risk ratio that exists, and many times we take the calculated risk to do something, or to travel, or to take certain drugs. We trust the system that checked for safety, but many times the safety is not there, or the person could be allergic to something, which results, by the way, in like 250,000 people dying, according to Johns Hopkins in the United States, from doctor mistakes, simply giving somebody a wrong medication that they're allergic to, a wrong contrast that made from the shellfish, wrong procedure that could harm them. These are healthy people, or people that are not supposed to die, that die every year in America because of the doctor's mistakes. And that's a third leading cause, I believe, if not first, according to some, of why people die in the United States. That's unfortunate, because the risks are not assessed properly, and people are not given informed consent in order for them to determine whether that is that could be harmful to them. It also depends highly on the education that people get, in both in the medical education, what they know about their body, their physiology, what they eat, what certain medication can interact with. That also is on the person. It's not just the doctor. A person has to be careful and protect their health and know about their own body, what could be beneficial or not. Sad thing is that we ask, even when inviting for Shabbat, we're asking people, children, if they're allergic to something. This never happened in 80s and 90s. So one has to ask what changed in the pharmaceutical drugs, in the environment, in chemicals that are added everywhere, that children now are born allergic. What changed in the prenatal care? What changed in post-pregnancy? What changed in millions of tons of formula that's pushed down the children's sensitive stomachs instead of the mother's milk, right? So these are questions. These are big questions. I have some answers to that, but I do want the audience really to assess it for themselves and ask these questions, because eventually when something happens and God forbid child becomes sick or autistic or develops a neurological dysfunction, those all impact the entire family. And to cry afterwards and say, well, I didn't know, that's a question. Did you not study? Did you not take proper measures to prevent these kind of damage? Or did you just rely on authorities? Did you listen to your rabbi who doesn't know anything about this procedure and says trust doctors? In fact, any rabbi that says trust doctors, or lazy, or ignorant, or purposely pushing people towards something that Torah wants assessment, and the rabbi is pushing them to trust doctors. Doctors today, no matter how religious, would have to comply with their licensure, with their ability to practice, and they're not going to trade that off for someone's questions about their health, complaining. As long as they're following procedures, it's all good. Recent case, I hope everybody's following it. It's a terrible case of Lindsay Clancy trial, where the woman who had a postpartum depression was given upwards of 13 different psychotropic drugs, antidepressants and so on, in order to manage her mood swings or condition or depression. And the woman ended up unfortunately killing her children. And sure, the blame can go around around the room, or the husband paid attention, the parents paid attention. But it was really remarkable in this public trial that many professionals, doctors who prescribed these medications, did not even bother to see which other doctor prescribed what. It was a mega failure of the system. But most importantly, it was lack of care on the part of the professionals that's supposed to guard someone's health. And person's blind trust in these professionals is what causes diseases, and it squarely lies on the medical community that with the polypharmacy that pollutes the people's lives with drugs and claiming that they help when they don't. The serotonin theory of imbalance is dead a long time ago, and they still have a problem admitting it. And the same applies to any other drug or vaccine. Professionals don't really care. As long as they're following procedures, they consider themselves exempt. And even if they're sued, they're covered by malpractice insurance, by institutions, by governments, and so on. All these cases have to be viewed on an individual basis, and the person's health has to be assessed on an individual basis. Something administered to a healthy child versus to a sick or immunodeficient child is not the same, and will produce different effects, short-term and long-term. Therefore, the dilemma is that we are individuals who are facing public institutions that govern our life. This could be hospital systems, schools, government itself, and all of that is made for the public. It's not made for individual. For instance, you have a compulsory education in schools. So school says, in order for me to function as a school, I have to demand vaccination records from all children. Now, some states allow exemption, and that's good, and they should. New York State does not allow exemption for religious purposes, but for only medical purposes. Not a single doctor that I know that would risk telling the government that this particular patient is exempt from vaccines, and that's a big fallacy. That's simply not true, that there's no medical exemptions. Obviously, in case of the child being so sick or a person being so sick that they might die from administration of the vaccine, and hopefully the doctor recognizes that, which in many cases doesn't happen, and person succumbs to the symptoms of the vaccinations. There's a lot of death and injury. But in general, the schools demand certain paperwork, and parents pressed against educational goals of their children. They cannot afford to homeschool, let's say, or to send the child to a different state. Although these are all viable options. Homeschooling is something that I've done and many people I know have done successfully. And the money usually you save in the yeshiva system is enough for one of the parents to stay home. If you have 3 children or 4 children in the yeshiva system, trust me, you're saving enough for one adult's salary, full salary, and the person can stay at home, a mother or father, particularly if it's a mother, and she could be nurturing and provide good education to her children, and find other groups for interaction. That is what I've done for years, and I've seen many people do successfully, and I've seen the reverse in the school systems, where children fall off the schedule, they're put in the class where they don't belong, they fall behind, they experience all kinds of peer interactions, anxiety, particularly in the teenage years, and all of that can be avoided by good, wholesome homeschooling, and that also provides a better nutrition, better environment, more time on hand to do other things, extracurricular activities, and no time sitting in traffic and in the polluted buses on the way to school and from school. That is definitely to be considered, but some people cannot afford to do that for whatever various reasons, and then have to consider other options, or moving to another state, or registering children online for schooling if they're old enough to do it themselves, and or considering some other options. I would never advocate vaccinations for the sake of health. They're not shown to deliver health. In fact, there are studies today that pit vaccinated versus unvaccinated children. Dr. Paul famously has produced a study from his own practice where he does not force people to vaccinate or not to vaccinate. And he showed that most children who were vaccinated produce much poorer results in the future diseases and ailments they acquire in all parameters. Unvaccinated children are a lot healthier, and those who went through COVID, now we know the truth, in spite of what Biden administration said, that it's a fault of unvaccinated. It's really a fault of vaccinated why we see such poor numbers, and we still unfortunately see the echoes of that time in people developing all types of setbacks, health setbacks. So what is the Torah's approach to all this? How should person navigate these treacherous waters, so to speak, and provide their children with good education, good environment, low risk? That all goes down to how we approach it. What is the assessment? Assessment of Torah's risk is something happened like if something tends to happen, and even though we don't have a clear indication it might happen, but there is a suspicion, there's a concept of chashash, then we are not only obligated, but we must save life and even break Shabbat to save such life in order to prevent even the smallest doubt of loss of life. So that works across the board in all aspects of life, not only health, but also assessment of risk when we travel, when we fly. There's a interesting question that's posed on this type of risk assessment. It's called binomial distribution. Binomial distribution is the concept of engineers creating, let's say, planes or cars. They would have to see what risk such machines carry. Let's say the plane is flying and it has 3 engines, and one of the engines shuts down in mid-flight. That is a certain amount of risk of that happening, depending on how many planes are in the fleet. Let's say if you have 1,000 planes in the fleet, and one engine shuts down on one plane, so you can assess the risk based on dividing this. So 1 in 1,000 risk, or one engine shutting down during the flight. It could be other factors of the length of flight and so on. But if the 2 engines shut down, that's a tremendously bigger number of chance of that happening. That goes up to thousands, one thousandths, and the 3 engines shutting down in the same flight, it goes up to 1 trillion. 1 in a trillion chance of all 3 engines failing. But the funny thing is, if that happens, we have to start questioning the common cause failures. What happened that could have affected all 3 engines? Was it the mechanic that did the same mistake on all 3 engines before the plane took off? Was it some volcanic ash that compacted into the engines and stopped it from working? That has to be considered. So when many adults or children experience a damage or symptoms from a similar drug, and all of them experience that across the millions of people, large populations, we have to question that. And when that doesn't happen because of the corruption, of the misinformation of the governments or pharmaceutical companies not releasing enough information, or FDA is rubber stamping approvals for certain drugs, so we all have to question that and see why does it happen. And for officials to say, well, correlation is not a causation, blah, 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 then the Torah steps in. Torah says no. We assess chashash, we assess what could possibly be there, and we err on the side of caution at all times, and therefore it's unacceptable in God's eyes for damage to continue when we know that something could be causing it. So first is shav al taseh. Shav al taseh is a very golden principle. If you think something is wrong, you don't do it. Obligation falls, according to Torah, onto the doctor, onto institutions, onto anybody who is participating in that. Torah doesn't care for what is a standard of care based on whatever. They could be mistaken. Torah has its own assessment of risk, and we have to follow that if in order for us to maintain our spiritual equilibrium with the things that happened around us. In Nazi Germany, there was a different laws and different Nuremberg laws that were instituted, where it changed how the people viewed other people, what was allowed, the killing of elderly and killing of disabled and retarded. So that was there. People who would not qualify. And if you think these type of practices do not take place today, or we're not running constantly a risk of such abuses, then you can take a look at Canada's medical assistance in dying, which is MAID law. It's assisted suicide law that now they are stretching further than any other country, and they're applying it to children and applying it for almost any reason. If somebody is lonely today in Canada, they could speak to the physician, even if they're minor, and it's terrible. It's something that a physician can now assist in ending life of somebody who is homeless or is minor or poor, and that somehow is considered normal. And that's the advancement. And this is exactly why we have to have a tether attached to the Torah and its values in order not to violate those principles, no matter what time or regime we're in. And constant truth always remain there, and should be able to guide us in this respect. So again, what should a person know before taking any risk? Even today, for instance, what constitutes a meaningful informed consent? The simple question: what is the meaningful informed consent? Knowing the benefits of a certain procedure, drug, or vaccine, knowing risks, knowing counterindications, reasonable alternatives for this or that procedure, consequences of declining the treatment, or communicating uncertainties honestly to the doctor and trusting that doctor. Whether the informed consent remains meaningful when vaccination is tied to, let's say, school or employment or institutional requirements. Many times the requirements are there for no reason, just because they're required. It doesn't mean the person has to take it. Many communities living in the United States today, they're religious communities by and large, they have refused vaccinations, they have refused any modern interventions, even surgery. You have Amish, you have Seventh-day Adventists, you have Jehovah's Witnesses. These are communities that won't even take surgery or someone else's blood. In fact, in hospitals, we have bloodless surgery for that reason, because Jehovah's Witnesses refused to take someone else's blood. So they had to come up with procedures that facilitated that. So it means that when community is totally dedicated to their spiritual way of life, nothing can penetrate that. And everybody will bend the knee to that community, because they will be steadfast, and they will die rather than comply. And that happened many times in history. The community said, you will not do surgery of one of our members, or we will do something that's unconscionable, but that's our way of life. And after that, the governments many times backed off, and that's why we have religious freedoms. It may make sense or not make sense to somebody. You might disagree with, way the Mormons live their life or whoever, but you have to afford them the religious freedom that God Himself gave, and Constitution confirmed that it is something that's indivisible. You cannot come in and swoop down in one day, eliminate all the people's rights, like it happened during COVID, or it happened during Katrina, where people's rights were simply, disappeared, and communities were left to fend for themselves. And when the draconian laws of measles were passed in New York, and many people suffered, that was the beginning of problem, where you eliminate a religious exemption for measles vaccination. And a lot of yeshivas threw out for the first time students from their institutions, which never happened before, because their forefathers, their prior leaders promised that no Jewish child is going to be thrown out of the yeshiva. And it happened to many people I know. They were left with no options in educating their children, particularly in the Jewish community, where education is primary concern. We base ourselves on education. We're people of the book, and we had no options. But fortunately, we could take example from the Christian communities in other places. When I started homeschooling, were a lot of resources available on the Christian side, meaning they uploaded programs, they taught you how to get paperwork done, what is required, how to deal with the state, and so on. And today, I know it, and a lot of people in the Jewish community know these processes, and they're better off because of it. These communities, they're really heroes. They put themselves on the line. Amish moved out of New York during that period when measles shots were mandated in New York. They simply took off and moved to Pennsylvania to their brethren who committed not to ever vaccinate. And that's also another proof, regardless of who says and what data is presented. But prima facie data is the community that you recognize. You can travel today to Amish country in Pennsylvania and you can see that not a single child takes one dose of vaccine. Everybody's healthy, everybody's in nature, eating good food, and they do not have problems that health systems tell you will have if you don't the vaccine, if you don't have the herd immunity. Herd immunity is a myth, is a lie. The reason why it's a lie, because they themselves require 80% to 90% of vaccination in the population, and none of that exists in populations that don't vaccinate. And they're fine, they survive. They don't have any pandemics, they don't have any outbreaks. And even if they do, these are mild diseases. They're not affecting the children who are healthy, and all of the children are as healthy as they can be because they don't have any chemical load in their system, and therefore the immune system's a lot healthier. Again, accidents can happen. Exceptions are always there to the rule, but by and large, they are successful. And we have to be looking, al pi Torah, according to our own assessment of risks and benefits. We have to be looking to communities that never happened to, and they're thriving and they're prospering, and we have to take an example from that. If we are to be a spiritual community, not just the followers, and not practicing religiosity that today exists in Judaism, and simply embrace what the Torah already tells us, everything is there. The refuah is before the Makkah, and you can look in the Chazal, you can look in Gemara, you can look in the Halacha, and you can adopt it to today, and you can translate it, and you can educate yourself on today's practices of medical procedures, and say, how does it apply? We do this with everything else. We, to nauseam, compare things in the Hilchot Shabbat, for instance. How does it apply to electricity today? And there are many, many writings on that. Not as many writings on health, and usually advice is taken from people who are mediocre at best. I hate to say this, but even the biggest poskim of Tzitz Eliezer or Moshe Feinstein, they took the advice from people who I would not consider luminaries of medicine or even biology. Was the Rabbi Tender advising him. Today, if you live today, would want a lot more data on things that are happening. He would have to examine this vaccine fiasco and with a new lens. And I believe that he would not recommend straight up certain procedures that present danger for children, and definitely not something that prevents them from going to yeshiva, to public place. But again, this conundrum exists because we live in the public world, in the public space. We sometimes have to adhere to some regulations, expose ourselves, for instance, to unnecessary radiation in airports and other things. But those come as a matter of fact. And if you live in a big city, you always have some background radiation, some chemicals exposure, dust in the air that can carry chemicals and harmful agents. But all of that is up to me. I can venture out and not venture out to Manhattan. I can stay, eat these types of food or those types of food. I can take this medication or not. It's up to me. But when it's forced, when it's compulsory, that's where the tyranny begins. Tyranny begins because all power corrupts and absolute power corrupts absolutely. And if we allow certain people, there's always going to be a good segment of bad players, politicians included, who will not always see our benefit. They will see their benefit and their money and the power, but they will not stand on your side, just like the Mishnah in Avot says that you should stay away from government because they bring you closer in the time of their need and will not stand next to you when you need them. And it's true across generations at all times. So some closing questions just for people to ask themselves and others before they make decisions that can be harmful to them, their children, their families. So what levels of evidence, evidence is necessary to establish safety? Right? There has to be that criteria, that threshold. What level of evidence is necessary to establish danger for this, but the same token? What is it today? What is danger? Should the evidentiary threshold for, let's say, precaution differ from the threshold for providing causation or proving causation? Who should bear responsibility? That's the corner question. Who should bear responsibility for all these medical casualties and injury? What information must a doctor disclose for consent to be a genuine consent? Let's say a person speaks only Yiddish and doesn't understand English very well. So I've seen doctors in hospitals explain, like to a 5-year-old child, what might happen. But that may not be enough because the person is capable of hearing more complex description of symptoms. But because it doesn't speak the language and doctor doesn't speak his language, they're not able to translate it correctly. When does public health protection justify, let's say, some limiting the individual's choices, let's say in the public setting? Yes, we understand that if I'm in the public, I can't have my way, but I have to be given an option to opt out, to abstain, not to engage with this. And I cannot be threatened with my job, my living in society, or position that I take, or any other threat would be tantamount of tyranny or the Nuremberg type of the laws. How should the Torah principles that we have of pikuach nefesh, of sakana, which is sakana chamirta miyisura, our medical treatments of personal responsibility for damages, how should they interact with one another? What are those boundaries? And the rabbis have a duty to explain it first to themselves and educate themselves, and then explain it to their communities. How does it jive together? Not just to give a nice parsha, Tashavua drasha, and then walk away, not tackling some of these things. Or many times in my case that I've been shut down and accused of things or whatever because they don't know, and because you trying to push on the existing patterns, and that can invigorate some anger towards you. But you shouldn't mind that, because at the end of the day, you have to be fine, your children have to be fine, your family has to be fine. And the final question, how should a person make a responsible decision when both accepting an intervention or refusing it may carry a measurable risk? That's what we're all talking about. The bottom line of all these is, what is the greater risk? Some people have told me that moving out of state with their children could be a greater risk because their children experience some signs of depression, and yes, that should be considered. But in general, the Torah values life. It's ultimate value, and we do everything. We don't ask a patient who's dying, well, would you be depressed if we took you to this hospital, that hospital? We preempt any danger to life, and we make sure that people are healthy in not in short term but long term as well. This is very partial, just indicators that we can have in order to research further. I can talk endlessly about different procedures and different diseases and so on, but it's up to you to discover them and to ask questions. Next time you're in the doctor's office, they have to give you full informed consent. They have to show you the insert for the vaccine. They have to show you any contraindication for the drug, and they have to talk to you in human language. When the doctor asks you if you have any questions, this is when he's counting for you to say, no, I'm good. And then it gives him green light to do pretty much anything that a system requires. But instead, you should say, I would have questions if I knew more about this. And at that point, you're going to bore somebody to death, and they may not want to interact with you. They like to make a quick buck, and there's zero education coming from doctors today in any community. I have not seen doctor go up on in public in the shul and say, do these things to protect yourself, protect your children, and that's missing. Yes, I know why, partially because of the licensure and inability to speak publicly about certain things, and there's HIPAA laws and other things, but a person can give general direction. That doesn't just go for doctors, goes for lawyers and educators, that when the outcomes like this happen and the people don't know what to do when they want to homeschool. So the first stage is they don't want to vaccinate, and then becomes a question, what do we do as far as school? What are the legal boundaries? At this point, the lawyer can be advised, and if the lawyer is the good steward of law, then he'll be able to provide guidance to people who want to, let's say, homeschool, and what paperwork is required. Other professionals can come in to assist, let's say teachers, to assist with curriculum. I'm an educator myself, and I had to go and find curriculums, and now I can share with other people. If you need anything, you can PM me, and I will provide them gladly to deal with the state and take state tests. That is also required. And again, the benefits of homeschooling are tremendous. One should not look negatively at this. And in interaction, many people ask me, what about his social life? What about friends? My son had more friends than anybody in the school system. In school system, you're forced to be with friends with whoever is in your class or in your school. In the homeschooling system, there are plenty of groups, chess groups, sports groups that you can enroll your son in with all the extra time you're going to have and extra money that you're going to be saving in tuition, and then you can tell me if you don't have enough interaction. At that point, I think it's safe to say that there's plenty of choices for people who want to homeschool. And again, moving to a different state, there's plenty of free states like Florida, California, Arizona. I've considered those states at some point. But again, if you are not able to move, then there are options of homeschooling. And also busing children to a different state. For instance, parents in New York can arrange busing to New Jersey, which takes a religious exemption and allows students to be enrolled in their schools. That is also possible online, where school is just as good as one physical school, and after COVID that became a norm anyway. People prefer to be at home and not waste time in traffic. If you noticed, I'm not talking about solutions for parents who want to partially vaccinate or create a distance between the shots. That's all fine, and it's probably better than nothing when you're dealing with the onslaught of vaccines that they do. By the way, New York does not adhere to any federal government regulations that came down recently. The governor wants to continue doing the same thing, so we kind of stuck here in New York. But the reason why I don't address this side of the problem, because of the practical considerations and pharmaceutical considerations of unknown nature of these shots and how each child was going to respond to it. So none of them 100% safe by their own admission, and therefore one has to try to find other solutions. And if moving to another place is better, then one should do it, because those states provide choices. And obviously none of it is connected to risk of disease and dying, because if you allow people to opt out based on their religious exemption, or even philosophical exemption like in California, and religious exemption has to be sincerely held, and no rabbi or priest can determine what that religious exemption is, then obviously you don't have herd immunity, you don't have the danger that you proclaim that you have with these diseases. It's simply a matter of fact that when people abstain, or communities in totality do not vaccinate, they do not have problems that proponents of vaccines say they would have if they don't vaccinate, and it's a prime evidence of mistrust in the institutions and health systems, because they have not shown to be true, and the assessment we have is the Torah's assessment of risk and benefits. People are healthy, people live happily in other countries. There are countries that don't have any vaccination programs or have much smaller vaccination programs, and their population did not suffer any outbreaks. So this will conclude our short introduction. Hopefully you will get some interesting ideas from this and be able to research on your own. None of this obviously is medically factual. What I'm presenting is your ability to research based on the points I've presented, and all of that goes to our spiritual strength and ability to resist, guided by their interests and not our benefit and health. I wish you and your families the presence of mind to make right decisions, and you should have a siyata dishmaya in guiding you in all proper ways of health. Please subscribe and follow my channel for more interesting lectures every week, and please PM me if you want to discuss something interesting along these lines of health and Torah. Thank you. Have a good night.